for everyone. So the first thing I just wanted to go over, just a quick agenda. We're going to talk about our membership, some statistics, and then some highlights, I think, coming forward. So this is our current group of members. I need a new picture because my hair is now much longer, but we have a great group of people, several which I can't see when I'm presenting as well, but hopefully have joined us for the call. We have a new member who will be taking over for me, Dr. Shaw, who's a surgeon from Emory University, who I'm very excited about, to bring a different perspective to the pediatric PC and bring a surgical perspective, which I think will be very valuable in addition to the other leadership members. So I just want to thank all the members of the leadership who have been really helpful throughout the year in different things, including like our webinars and thinking about priorities for the group. Just thinking about membership across the pediatric community and what IDNs we're involved in. You can see that there's a wide range, but most of us are pulm, cardiac, or surgery. I was happy to see actually there's such a large number of surgery. Because I think it's important for us to have this not only surgical opinion, but diversity amongst the members of our community so that we can get different voices as we think about priorities and education. And then as far as our trends, we are essentially a net no change, which although I'd like to grow the community, I'm glad we're not shrinking. And I hope that now that there's been a re-emphasis on the importance of the professional communities within ISHLT, that we can have growth. I mean, pediatrics will always be a somewhat smaller section, but I think it's an important section that brings an important perspective. All these adults were children once. So hopefully we can work on growth as a goal for the coming year for our community. And then looking at interdisciplinary networks, you can see a wide range across the different types of networks. We have a good amount within the heart failure, transplant, lung transplant, MCS. Happy to see so much early career in trainee. I think that's super important for bringing up the next leaders and community members. And so I think one of the things as we think about growing our community will be an emphasis on engaging our trainees and engaging junior faculty to help increase their, ownership of being a community member, but also their involvement within ISHLT, because there's so much that community members and ISHLT members in general can be involved in. And then looking at, hold on one second, that there was a change in the payment structure for membership. And so you may have noticed if you renewed your membership this year in anticipation of the next meeting, like I recently did, there is some tiers, which was meant to increase, hopefully, membership amongst different groups, including early trainees and non-physician members. And it looks like we have been successful. I'm not sure, Greg, if you want to say anything about that.
Yes, the results of changing the dues structure to encourage to remove barriers to participation for these groups completely outstripped our goals. So and this was just the first year, so we're really launching into some intentional communication with members to make sure that they are engaged once they join, and then to additional prospective members in physician and non-physician categories around the world.
Yeah, so very exciting. I think anytime we can increase access. Just looking across the world, as Greg says, what is the makeup? You can see that historically we have had a large North American presence, but not insignificant Europe and other areas amongst the world, which I think is increasingly important for sharing ideas. Obviously, lots of ideas and experiences important across the globe, and we learn from everyone else. So that's going to be important. And I think that's many of our societies have tried to increase that membership and access across different worlds. One thing I didn't know, Greg, and I was curious, when we have the tiered membership, do we have membership tiers for underserved or countries that may not have as much access to support, monetary support from their institutions?
Yes, the tiers are based on the World Bank categories. So it's based on 3 different economies: developing economies, or high, middle, and low income economies. So those middle and low income economies are those underserved areas. Does that answer your question? Or were you?
Yeah, I was just curious if we had some tiered pricing too. Again, just trying to increase access
Yeah.
to different populations for different voices and experience. Okay, great. And then just looking forward to seeing, I will be at ISHLT in Prague, and I hope many of you will be too. And we will have our own professional committee meeting. So we will be having IDN lunches and we will be having IDN evening meetings. Our meeting will be Friday 12th in the evening. There will be snacks and drinks, so tell your friends, please come. And I believe there'll be good snacks and drinks, so everyone hopefully will come. And we'll have some good discussion. It's good for us to, I think, not only meet other members in our community, but also brainstorm on ideas and collaboration. So hope to see everyone there. And then we have professional webinars. Ours just occurred yesterday. I feel like we had more than 39 people, but I think more people came. I don't know what our final count was. I forgot, Juliet. You know, you emailed me.
I will look that up.
I can't remember, but it was good. We had a good turnout. It was a really good discussion. We talked about novel desensitization and kind of the current approach to desensitization in both heart and lung transplant candidates. And I think it was good discussion. So if anyone missed it, it is now available on YouTube, the ISHLT YouTube, and please share that with your colleagues. And then just, I wanted to highlight, you know, sometimes in pediatrics, we feel like, you know, the voice of pediatrics, the concerns that we have are not always included in all the guidelines because, again, we're a small portion and there's so much adult disease. But there are 2 documents in process that I wanted to highlight for the pediatric. One is the guidelines for the management of pediatric heart failure, which is being updated from a previous document. And then also the consensus document for referral and selection of pediatric lung transplant candidates. So I'll be excited to see these documents as they get completed and available for membership. And also, you know, the committee is always looking for additional ideas from both the IDNs and communities. So if you ever have an idea or you're looking for guidance or a consensus document that doesn't exist or is, you know, too old and out of date, please message the leadership because we can bring forward those ideas to the S&G and try to get those forward to a document. And maybe, you know, if it's something you're impassioned about, hopefully you could help lead that or even be an author on it, which would be great. And then again, just to highlight at our meeting in Prague, we have our pediatric meeting. Please go to your IDN luncheon. I found those to be very wonderful. There is a pediatric core academy, which is really great. Just if you look at the programming for that, that will be all day on April 9th. But if you're not going to the core academy, maybe your plane doesn't land on time. There's also a really great DEI workshop that will be available in the afternoon you can sign up for. And then just looking through the program for pediatrics, you can see that we have 3 dedicated oral sessions, 2 dedicated symposia, and then 2 combined adult pediatric symposia, all of which look really good. And then we have our poster session the evening of the 12th, right before our community meeting. So you can go right from the poster session straight to the PC meeting, snacks and drinks in hand for the whole evening provided by ISHLT. So that, other than just looking forward, so this is maybe an area for discussion or just to remind members is that as soon as this meeting ends, we are already starting to think about the next meeting and symposia. So when we have members at this meeting, we are, you know, you see a presentation, you get excited, you're like, oh, I could build on this idea. Write those down, think about them, find the person who wrote that paper, talk to your colleagues, and then bring that as an idea for a symposia proposal to the leadership and we can help. And we usually have what we call office hours a couple times. And the IDNs will also have these kind of meetings, but we want to support multidisciplinary pediatric, or at least partially pediatric symposia on topics that are important to our community. And we will start this really in general right after the meeting. So just bring those ideas, be ready, and we can start working on those. I don't know if Greg or Julie, if anything to comment on that.
Nothing to add.
No comment, that's fine. And then also just a reminder, the JHLT Open is still soliciting for topic ideas, and we're still within the period where they're waiving fees that won't last forever. So if you have an idea and you don't know what kind of co-authors to look for, or you need some kind of help taking that idea further to what may be a manuscript idea, please, feel free to reach out to the PC leadership so we can help connect you with other maybe co-authors or help with ideas. And then we're always looking for a webinar idea. I'm sorry, and you do have something for that, Greg.
I do have something to add on that. Yes, unfortunately, the complete fee waiver period ended at the end of January for JHLT, but for all of 2024, the article processing fees are discounted by 50%, and for ISHLT members, an additional 20%. So it's 70%, a 70% reduction for those article processing fees for ISHLT members for all of 2024. So it's still a really favorable time to participate and submit.
Thank you for that clarification. I'm mistaken there. And then just lastly, webinar ideas. I think if you have a webinar idea, if you want to speak on a topic or you're interested in organizing speakers on a topic, please also send that to the PC leadership. We usually have to prepare these months in advance because we have to have enough time to identify speakers, identify a time, and then also give speakers plenty of time to, produce their talk. And so we don't like to do this last minute. Juliet 100% does not like to do this last minute. And so we need to make sure we're respecting the authors and time and the ISHLT admin time to make sure that we're having plenty of time. But if you have ideas, then please bring them forward to leadership so we can start working on that as well. And then that's it. That's all I have. So if anyone has any, it looks like there's something in the chat. Oh, 67 registered and 42 live attendees for our webinar yesterday. Thank you, Julie. So we don't have a ton of people on but we have some people. Does anyone have any thoughts, questions?
Hey, Katie, and Greg, where are we at in terms of the transitions discussion? I think we left it that we're going to ISHLT leadership about transitions, but I think pediatrics professional community will play a big role in that initiative as well.
I don't know, so I'll let Craig answer.
And I will pass that over to our president-elect.
Oh, I see your hand is raised anyway, so that's perfect.
Yes, I thought so. Good evening, everyone from Zurich. So I thought that Greg would pass this on to me. Great to see you all. So basically, what's going to happen, I think Simon Hirsch and I, we took this on, this initiative about transition, and we're going to reach out to leaders also within the IDN and the pediatric professional community, and we're preparing basically a proposal to the board of directors to present it at the April meeting. The meeting interestingly occurs exactly in the morning or the afternoon when there's the Pediatric Academy happening. And I have the pleasure to actually give the last talk at the Academy on transition. And I hope I can bring some very brand new news then from the ISHLT Board of Directors, and hope that they have voted at that time and for this proposal. And I'd be very happy to give you some more details about that at that time. But I think it's at good hands. When Simon and I mentioned this at pre-board talks, I think prior to the board meeting that just occurred last month in Florida, there was a lot of support that I could sense. And I think so I'm very hopeful. Others have been there as well. Stella's been in Florida as well. I think overall, I think there's great support from the leadership society for this issue on transition. And let me just add to what you said so nicely before about Prague. I mean, obviously everyone is invited, also from North America. It's a long way, to come to Europe for you, but Prague, as our program chair is always saying, is a great opportunity, is a great city. And I'm sure the Czech beer will be very nice at the pediatric community reception. So hopefully everyone is coming. As far as I know from Greg, a couple of days ago, he told me that we are actually on track with regards to registrants for the Prague meeting, obviously comparing it to other non-North American meetings. That's always very important. But again, I mean, Prague is a very exciting city, so hopefully many of you can manage. And then obviously attend either the academy, but definitely to attend, I think, the PC meeting on Friday evening. And there's another thing, obviously, for those who can't, there will be other opportunities, and certainly, as you mentioned before, just after the meeting, preparation for 2025 already going to start. There's always a very tight schedule, and I think we've done very well with regards to what we put into the pediatric program. And I'm very excited because I'll be the president in 2025 when we meet in Boston. Obviously, being a pediatrician, I'm going to make sure there will be a lot of pediatric content in the program. And then it will also provide the opportunity for those from North America who are unable for financial or other reasons to travel to Europe this time, then to make it a great meeting in Boston. And now Boston is always a very attractive city for many people. It's ideally located. And so hopefully it will attract a lot of you. And I can promise you, together with Kieran Kush, who is the program chair, she's an adult cardiologist from Stanford. Many of you might know her. She is the program chair that I selected, but I will be on all those calls when it comes to the program. And I make sure it is a great pediatric content also for the 2025 meeting.
Thank
That's
you.
all I have to say.
I'm excited, and I'm glad to hear that the transition, emphasis has continued. And I also look forward to hearing exciting news. I won't be at the academy, unfortunately, won't be able to travel that far in advance, but I look forward to hearing it.
We'll definitely spread the news.
Since we have a few minutes, so so we're developing this proposal for the board, as Dr. Bendon mentioned, and what we'll be working out over the next month is what are the deliverables. This will be a task force, a time-limited group with specific deliverables. One of those things could be some sort of an ongoing committee or body to continue the transition discussion. But I'd love to hear thoughts on the kinds of things that could be done to support this.
I think that, I mean, just as someone who's at different institutions who have done transition differently, I've seen it, done well and some now evolving. We're totally rehauling our transition program here. I think giving some, evidence-based or best practice experience on transition, things such as what age to start, how do you deal with patients who are developmentally never going to be able to be independent, how do you help when you have people with mental, who depression, anxiety, but so special populations. But I think, how early to start, just a framework, because I find that, and other people can speak to this, that people sometimes feel like, how early do I start? What do I talk to them about? What are the goals? And I've been at a center where we had a very structured, at age do we start this? This is the goal for the first year. This is the goal for the second year. By the time they're this age, you want them to call on their own meds, call their own appointments. By this age, you want them to, and so I've had just such very structured. So I think like some sort of basic framework for transition that lays out some of these things, goal directed age, and then also, like I said, addressing special populations, because transition in patients who have significant barriers to ever being independent, I think is a major thing. And then also other considerations such as, durable medical attorney, guardianship, things that also we have to think as people go into the adult world that we're thinking about. And that's my thoughts. I don't know if anyone else has any others.
I think, hey, this is Sean. I think just to add on to your comments, Katie, I agree 100%. I think having almost a transition readiness checklist that they have to satisfy in order to allow for that transition, because what has surprised me is my own evaluation of somebody's readiness certainly does not correlate with how ready they actually objectively are. And some people, and so I think maybe having, some of those elements that you mentioned, do they know their names of the medications? Do they know, do they understand what tests need to be done, so on and so forth. And it could encompass a variety of these sort of things that need to be checked off before they get handed over.
And we've also talked about the importance of neuropsych testing, because some patients will present, this is a problem in pediatrics, some patients will present that they are mature and appropriate. We have currently an 18-year-old who functions at a 10-year-old level, but she looks like an 18-year-old and she will front as an 18-year-old. So I think you really want to have develop some psychologists involved in this. That's going to be really important because they're going to talk about developmental appropriate assessment of the level of ability and also understanding how these patients learn. Some have memory issues, some people need things in writing. So just psych is going to be super important in thinking about this transition.
Well,
Katie and Sean, I think, oh, sorry, go on, Estella.
Very quick. I was just thinking that perhaps the most important thing is to emphasize the multidisciplinary team and to involve each professional, like alien professional, like psychologist, pharmacy, and social worker, physicians, and explain the way that they will reach out to the adult cardiologists, because usually the patient and parents are very linked with us for pediatric team. It's very hard for them to to go to adult clinics. So perhaps these are the important things, and adherence as well.
Yeah, completely agree with what's been said so far. Hey, this is Kyle. Yeah, I really like the idea of if we have some best practice checklists. I think that'd be really helpful to standardize across different centers. Greg, to your point about what deliverables might be good to ask for, it might be helpful to ask also for funding for research. I don't know if there's a great database or registry for data on transition. Certainly, the success and failures, and I think that might be helpful to track, especially if we're looking to use data to guide, best practices going forward.
And Greg, I would also say that besides some general consensus guidelines for transition, I also think that having a committee that would maybe have people that renewed over time that was multidisciplinary and would include an adult, because I think the adults get our peds and sometimes they're like, do you do anything for transitioning? And we have tried. So I think having an adult person on this committee who, even if it's, in coordinators and nursing, would be really important. But I think having an ongoing committee who will continue to assess the needs of transition, and maybe even help choose what research or projects come forward next. But I think it's got to be multidisciplinary and it's got to involve adults too.
Great, thank you. We can, so this has been very helpful. That's exactly what I was hoping we'd get from this group. So we'll give that back to Simon Urschel as we develop this proposal. Following on to one other note that the hotels in Prague are filling up. So if you haven't yet made your reservations, I recommend you do so.
I don't have anything else on the agenda. Does anyone have anything else? We can end early. It's okay if we're efficient. But does anyone have any other thoughts, questions, anything they want to bring up?
No, Katie, I was just curious, it seems that, as you pointed out, majority of our members are from North America, with the smaller smaller section of the pie from Europe, and then, smattering of other countries. Is there a concerted effort for ISHLT to like go there? I guess maybe a question for you, even Christian and Greg, to go to these countries and maybe sponsor some events, so that, because it seems like it's no longer, a few continents doing it. It seems like it's very widespread, and it'd be nice to get some of their engagement.
Yes, that's a very good point. And obviously, being myself a non-North American and sitting in Europe, I always try to emphasize the international aspect of the society. But you're absolutely right. I think at the moment, and Greg might correct me, it's about 70% or so of members sitting in North America. But nevertheless, there are more than 50 countries around the world represented, which is great. And it's well more than 3,000 members. So yes, there are lots around the world. And exactly in our meeting in Florida, that was actually also the LAF and the board. We had some specific sessions designed where we looked at some of the strategic goals, because what is really great, the board of directors has actually assembled a strategic fund to fund these kind of great ideas that are really game-changing for ISHLT. And one of the topics there was exactly how to engage members beyond North America and how we could do that. And obviously this was just the start of a thought process, and we actually have used an external facilitator to get some good ideas out of people. And it was a very engaging discussion. And yes, that's exactly what we want to do. And we talked about how we could achieve that with, regional ambassadors to be used, and then obviously having some regional meetings as well, looking at specific entities with regards to language, and hoping that we can go along a bit like as we did with the ISHT in Espanol. There's been a very successful subgroup reaching out to the South American market. I know now Estella is on the call. She's based in Sao Paulo in Brazil, where one speaks Portuguese, but at least I think all the other countries, I think in Latin America, are covered with the Spanish. And so from that point of view, I think that's exactly what we're talking about. For Australasia, we're also talking about how we have to subdivide maybe that region. We had a colleague there from the LIF who is practicing in Singapore. So we also had people from those areas. Peter Hopkins, our secretary, was there from Brisbane. So really trying to bring this together. You're absolutely right. And what is still a very white spot is actually Africa, because there's not that much of transplant activity going on. But you're absolutely right. That needs to be strengthened. And I'm very positive following that great meeting in Florida, where we really put some good thoughts together. I'm not sure if Greg wants to.
No, I think that's great. The one comment I'll make, Christian, is Katie, during my fellowship, Katie and Dr. Cantor and others from my institution encouraged me to join ISHLT. Many on the call here are members from their time of their fellowship and have never not renewed their ISHLT. So once you get into this incredible organization, you feel warm and you feel like you're a part of something that's bigger than your own self, which is great. And so I almost feel, and I'm sure you guys have thought about this, but maybe the barrier to entry for a fellow from an underserved or a community where unless you maybe just say, okay, we're going to give it to you for free, and it's easy for me to say, and then just say, why don't you just be a part of this community, see what you feel like, and in a couple of years when you are an attending, then you can charge them, whatever.
It'd almost be nice to have like a scholarship for a membership scholarship for young physician, or just to get.
We've really talked about all of these things. I mean, obviously there's, now we have initially we had a membership task force, then we had a membership committee where we looked at these tiered, like different memberships to have those, lower income countries being supported. Exactly what you said before, and we talked about even about completely waiving the membership fee below a certain age category. But we're just in discussions of that, and then we were also thinking about how we can even go below the like the fellowship level, because sometimes we might even have people now we can implant something, imprint something, an interest in transplantation and mechanical support, even in medical students. Sometimes you have amazing medical students that they come to the meeting and they present a poster or they have a mini talk, and you think, oh my God, they're so good, they're so smart. And how do we get those interested and excited for our society? And that's exactly what these ideas, they were all circling around. And I think obviously we need to get some structure into that, and the funding needs to be okay. But it was a very open discussion, and as I said, even about waiving membership fees below a certain age category, and exactly as you said, may the attendants pay for it. That's good.
I was
Great.
just
Oh,
thinking,
Celis.
sorry, I was just thinking that perhaps, for example, today we have a paper accepted, and then we will not, ask for fellows to pay for that. For example, 2 fellows participated in the paper, but we are not asking her to pay for, for the paper. So perhaps we can decrease for fellows the registration fee or something like that for them to participate more at our meetings, or students as well. Just something that I'm thinking about that.
There is a discounted fee for fellows and trainees, and it's a substantial discount. I can't recall. It's less than half, I believe.
Okay.
There is more than that we can do, and it's funny that that these ideas keep coming up. Free registrate or free memberships up to a certain age. It keeps coming up, and I think that there must be merit to it, right? And other ideas that came up were a sort of bundled membership where you can participate in several organizations. That would be a little more complicated because there are other parties involved. But we're also looking, or we will be looking at membership reciprocity with certain other organizations, and maybe it's IPTA or other either regional or organ-specific kinds of organizations where somebody could be a member in both. If you join that, you get an ISHLT membership for $99 or something like that. Because all of these points are exactly the discussions that we want to be having. We know that membership growth is going to come outside of the United States and outside of North America, and we know that the future of the organization depends on getting young people in. And even, the discussions that were had at the strategic meeting down in Florida, we were talking about filling the pipeline with people. How far back do you have to reach? Because in some cases, it's too late when they've already made their decision, right, about where to specialize. So should we be working to influence people to come into this field, to come, to become pediatric transplant specialists? And filling the pipeline that way. A lot of good opportunities for ISHLT.
Okay.
Okay. Any other, or speak your piece, or forever hold till the next meeting. Any other?
I'm gonna say, I guess I'm the only person speaking. Go ahead, Sean.
Hi, Sean.
Sorry. Hi, this is Sean West. I was just going to apologize for being late. I was stuck in clinic. In regard to the to go back for the transition process, I think that's timely and that's huge because we're struggling with that in our group. And I'll read over kind of what Katie said. Like we include our psychologist, and that's been very helpful in kind of helping assess who's ready to go to the adult program or what they need to be able to go to get ready. The Pediatric Society and the American Society of Transplant did put out a transition checklist a few years ago. I was part of the committee that worked on that. I honestly don't know where that went after it left our committee. I have seen like not a published version. I've seen a version of that on their website, but at that point, that's going to be old. That may be something that you could look at and kind of start with as sort of a starting point.
Noted. Thank you.
Thank you, Sean.
No, I was just gonna say, Katie, I think can you remind me, Katie, for the webinars, can non-members join and view the webinars?
It's a Juliet question.
Yes, they can.
Like,
For
Awesome.
the ISHLT webinars are open to non-members, as is the ISHLT Connect professional community platform. The IDN discussions and the other groups are members only, but the professional communities are open to non-members. All you have to do is sign up and you can ask questions, answer questions. So if you know somebody, tell them it's free and encourage them to join.
Because this is
Okay,
really
yes.
high value content, right, Katie? The one that we had
I
yesterday.
just sent it to all my pharmacists, so it would be kind of sad if they couldn't actually open it.
Okay,
But
great.
yes.
Yeah,
That's good to
that's a
know.
nice way to get like the experts directly with the people who are interested, and if they see something like this that's free, then they sign up hopefully for the ISHLT membership and then become a part of the community. Yeah, got it.
So,
Yeah, good point.
thank
Okay.
you.
Okay, I don't think there's any last takers. Otherwise, I'm gonna say goodbye for the day and remember, email if you have any ideas or questions to leadership.
And see you in Prague.
And
Yes.
see you in Prague, all the bridges.